guys, this is Dr. Brenden Cochran from Interactive Health Clinic. Hope you had a fantastic weekend. Bringing you another proactive health tip of the current situation we're in. All right, so what you are probably noticing right now is more and more of this virus is now penetrating or making its way into the rural communities. And the biggest thing again is, yes, this virus is really, really bad. It really does tear through some people and then not do anything to other people. And the biggest thing that we want to make sure to be cognizant about is not to overwhelm the healthcare system. Because anytime we overwhelm that system, it's not only just these patients that need care, but also all the other patients who are getting hospitalizations due to other emergency issues as well. So a few things we are learning. One, what we do know is we're starting to learn that the mortality rate of this is much lower than what we initially thought. So that is good. The mortality rate, as I've been talking about, tends to affect people with pre-existing conditions, or when you start to get over the age of 65, you're at more risk of mortality. Now, the thing we do know is if you end up being admitted into the ICU, there's a very high likelihood overall, if you're in the ICU, that you have a troublesome number or very low likelihood of getting out of the ICU, which means that your mortality rates are quite high if you are entering the ICU. Now, if you're home, you get this thing, you get over it, it's the quote mild cases, mortality rate on this is pretty low, is what we're learning. Still a little bit higher than the average influenza, but much lower than what we were concerned about initially. Now, here's the problem, though. Some people get nothing, asymptomatic. And then what we're trying to learn is if those people are asymptomatic, they get hit with it the first time, is it worse if they get hit with it the second time? Because we've seen cases like that where people have been reinfected, and it seems like it's worse the second time. So the other problem we have is when people get this, the people that are getting very, very violently ill, 3/4 of those people are expected to have long-term side effects, kidney issues. I saw one article that came out, 3/4 of individuals that went through symptomatic states had an increased risk of long-standing heart problems. So this thing really does beat you up. So people have ongoing fatigue, ongoing kidney problems, ongoing heart problems, ongoing some visual problems. It kind of hits all over the place, again, that you have a vascular system. Now it does typically, again, attack the people with comorbid conditions. However, it does occasionally pick on people with nothing as well. And that's the unpredictable part of this. What we do know in common is people that have low vitamin C, low vitamin D are at larger risks of getting this and walloped by this. So micronutrients just play a huge critical factor in your overall outcomes. And that plays a critical factor in outcomes for any disease process, as we've talked about in several other videos. So that's what's going on right now. Now, an interesting thing I wanted to share with you, I thought it was an interesting study because we've had several people saying, well, people out there that are asymptomatic are not a problem. It's the symptomatic people. And what we're seeing here is a new article is published in JAMA, Journal of American Medical Association, August 6th. And basically it showed that the clinical course and the viral shedding among asymptomatic and symptomatic patients, and this was done in Korea. So they looked at this, and the big results that we see is that it takes, on average, people between 13 and 20 days, the average being 15, for a person to get in contact, get the infection, and then start showing symptoms. So 15 days to show symptoms once you've been exposed. Now that's quite some time that you could be exposed and then you could totally be asymptomatic, right? Or you could be exposed and then never get anything and be completely asymptomatic. So here's what we have bottom line. The asymptomatic patients that zero converted, which means we tested their PCR tests for viral shedding. We also did some antibodies. We started to get an idea of basically how long are these people potentially contagious for. And negative conversion, day 14 and 21 were the parameters, is what we looked at after that person started to show symptoms, basically. And what we see is that at day 14 and 21 of symptomatic people, people with symptoms, 33.7% at day 14 were negative. So that means still 70% are positive. We get up to day 21, now we have 75.2% that are negative. This is symptomatic patients. So what that means is that up to day 21 and you're symptomatic, you still are testing positive and still potentially could be viral shedding. All right? Now, what about asymptomatic patients? So asymptomatic, no symptoms at all. At day 14, we showed 29.6% were negative. The rest were positive. This is a larger positive ratio than the symptomatic patients. And then at day 21, we had 70%, or 69.9 is what this actual study showed. So again, compare that to 75% that were negative with symptomatic states. This population of asymptomatic shows 70%. So there's still 30% that are showing positive readings that are asymptomatic at day 21. And this is troublesome because then that means that these people are showing viral loads in asymptomatic patients that tend to decrease more slowly than, say, a symptomatic patient. This is where we went back to a long time ago where we said there's these people that would interact or intermingle with other people that had no idea. They didn't look sick at all, and all of a sudden they got sick. And we talked about asymptomatic spreaders or super spreaders because they had no symptoms. So they mingled around in the community saying everything is fine. There's no fever, no cough, no fatigue, nothing that indicated that they were infectious. And this is the argument why we continue to say and reiterate wearing a mask, because the mask is not to protect you as the individual from other people, but it's just to protect you from spreading it to other people, because you may not have symptoms. You may be one of the many out there. Almost up to 50% is what we're seeing now are asymptomatic. So you may be one of those 50% that no symptoms, has no idea what's going on, but you are spreading this. You have viral shed, and you're going to do that a lot longer than a person who is sick showing symptoms. That is the key reason we do this, and that is the key reason we move forward and we win the battle with this, is literally we slow this down enough that it rolls through the population. Some people get sick, some people don't, but we're not massively inundated with this all at once that it overwhelms the health system. So it's just slowing this down. It also allows the economy to reopen because now you have somewhat of a containment on this versus the boom and pop. So when I see these people, they're out in these large groups, having these parties, trying to enjoy summer, and I know you do. I'm telling you, you got to be really, really careful, especially if you're indoors or you're really in close contact, because you have a high likelihood one person in that group is asymptomatic and spreading it to the other group. So keep safe out there. All right, guys, we'll talk to you next week. Hit the like button if it's on YouTube for you, or share this video. Appreciate all the comments, all the feedback you guys have been giving me, and keep on trucking.